Welcome back to Therapy Talk. Are you or your patient is struggling with low back pain and not sure what's causing it? Today I will make you walk through a basic physiotherapy assessment for low back pain that you can easily understand and perform safely. So let's start about the assessment. First and foremost, we should start with the demographic data of the patient, like name, age, gender, occupation, address, etc. Then we go for brief summary regarding patient, like present complaint, that is chief complaint, and the other mentioned histories. The severity of pain is assessed using visual analog scale, which have markings from 0 to 10 as shown in the image, in that 0 means no pain and 10 means worst pain possible. So you should show the scale to patient and ask them to mark it appropriately according to their pain. Ask about the mechanism of injury. How long has the problem bothered the patient? Where are the site and boundaries of the pain? Is the pain superficial, deep, burning, aching? Is the pain radiating? Is the pain centralizing or peripheralizing? Is the pain improving, worsening, or staying the same? Is there any increase in pain with coughing, sneezing, deep breathing, or laughing? Are there any postures or actions that specifically increase or decrease pain or cause difficulty? Is the pain worse in the morning or evening? Does the pain get better or worse as the day progresses? Does the pain awake you at night? Which movement are stiff? Is a pin and needle sensation present or anesthesia? Has the patient noticed any weakness or decrease in strength? Any weakness of leg while walking or climbing stairs? What is the patient's sleeping position? Does the patient have any difficulty with micturition? During your assessment, you must pay attention to any red flag that might be present, as it indicates severe pathology. Movement patterns also have to be observed. How does the patient enter the room? A posture deformity, inflection, or a deformity with a lateral pelvic tilt, possibly a slight limp, may be seen. How does the patient sit down, and how comfortably or uncomfortably do they sit? How does the patient get up from the chair? A patient with low back pain may splint the spine in order to avoid painful movement. An important part of the diagnosis of low back pain includes palpation of the lumbar spinous process. Factors that hinder palpation are increased BMI and anatomical abnormalities. PPIVM, passive physiological intervertebral movement, lumbar spine assessment, is a manual therapy technique used to evaluate the movement available at specific lumbar spinal levels. Neurological examination is indicated when there is suspicion of neurologic deficit or with any symptoms below the gluteal fold.